is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily, reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated products. About acne biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, "Just wash your face," or "Everyone gets acne, get over it," minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skin Care. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth-absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, though should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skincare products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. "I had acne and overcame it" differs from "I am acne-prone" in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. Celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, these theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84, Acne Treatment in Resource-Limited Settings. many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability. Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, salicylic acid formulations meant to be applied to specific areas or the entire face, typically 2 to 3 times weekly. They're left on the skin and provide significant exfoliation. These are powerful products best used by those with resilient, acne-prone skin who have already adapted to gentler salicylic acid products. Spot treatments apply high concentrations of salicylic acid directly to individual breakouts for targeted treatment. These are excellent for treating isolated pimples without exfoliating your entire face. Starting with salicylic acid requires a conservative approach. If you've never used it before, begin with a 0.5% cleanser or 1% toner used 2 to 3 times weekly. Use it for 2 to 3 weeks, assessing your skin's response. If your skin tolerates it well without excessive irritation, dryness, or sensitivity, you can increase frequency to daily use or switch to a higher concentration product. When applying salicylic acid toners or serums, use clean fingertips or a cotton pad to apply evenly across your face, focusing on areas prone to acne. Use about a nickel-sized amount for your entire face. Apply to completely dry skin. Applying to damp skin increases irritation. Allow the product to dry completely before applying other products. Some salicylic acid products are meant to stay on your skin indefinitely, while others are meant to be rinsed off after a specific time. Read instructions carefully. Common mistakes when using salicylic acid include starting with too high a concentration, using it too frequently, combining it with too many other actives, and failing to moisturize adequately afterward. Starting with 2% and using it daily will almost certainly cause excessive irritation, dryness, and peeling. You're much better served starting gently and gradually increasing. Never combine salicylic acid with benzoyl peroxide on the same evening initially. Both are exfoliating actives that can cause significant irritation if used together by someone whose skin isn't accustomed to strong treatments. Once your skin has adapted to each individually, you might combine them cautiously, but build up to this gradually. Salicylic acid makes your skin more sun-sensitive, not severely, but notably. Always use SPF 30+ sunscreen daily when using salicylic acid. This is not optional. Sun exposure can cause post-inflammatory hyperpigmentation in acne-prone skin, and salicylic acid increases this risk. Side effects of salicylic acid are generally mild and resolve with time or reduced usage. Dryness is common, particularly if you're using higher concentrations or frequent applications. Combat dryness by using a good hydrating moisturizer immediately after applying salicylic acid. Mild peeling is normal and actually desirable. It indicates exfoliation is occurring. However, severe peeling suggests you're using too much. Slight irritation and redness may occur initially but typically resolve within 1 to 2 weeks. Some people experience temporary worsening of acne as impurities are brought to the surface, but this purging phase is usually short-lived. Results from salicylic acid appear gradually. After 2 weeks of consistent use, you might notice smoother texture. After 4 weeks, you should see reduced comedones and fewer new breakouts. Most people see significant improvement after 6 to 8 weeks of consistent use. However, salicylic acid works best for comedonal acne, blackheads and whiteheads, and mild inflammatory acne. For severe inflammatory or cystic acne, combining salicylic acid with other treatments like benzoyl peroxide or prescription retinoids is often necessary. Salicylic acid is safe for long-term use. Many people successfully maintain clear skin using salicylic acid indefinitely as their primary exfoliation and treatment method. However, occasionally, skin can become desensitized to salicylic acid if used continuously for extended periods. If you notice that salicylic acid that previously worked well seems less effective, take a 1 to 2 week break, then resume using it. This often restores its effectiveness. Alternatively, you can rotate between salicylic acid and other exfoliants like glycolic acid to prevent desensitization. Guide 5. Benzoyl peroxide, Comprehensive Guide to Bacterial Killing and Inflammatory Acne Treatment. Benzoyl peroxide is one of the most effective and widely recommended acne treatments by dermatologists. Unlike salicylic acid, which primarily removes dead skin cells and excess oil, benzoyl peroxide specifically targets the acne-causing bacterium Cutibacterium acnes. Understanding benzoyl peroxide's mechanism, concentrations, and proper application is crucial for maximizing its effectiveness while minimizing side effects. Benzoyl peroxide works through a unique mechanism. It generates reactive oxygen species that directly kill bacteria. This is fundamentally different from antibiotics, which the bacteria can develop resistance to. Bacteria cannot develop resistance to benzoyl peroxide because it works through oxidative stress rather than targeting specific bacterial proteins. This makes benzoyl peroxide an invaluable tool in acne treatment, particularly since antibiotic resistance is an increasingly serious problem in dermatology. Beyond bacterial killing, benzoyl peroxide has anti-inflammatory effects, helping reduce the redness and swelling associated with inflammatory acne. It also has mild sebum-reducing properties and may help with some degree of comedone reduction, though it's less effective for this than salicylic acid. Benzoyl peroxide comes in concentrations ranging from 2.5% to 10%, with some over-the-counter products going up to 10% and prescription-strength versions available at higher concentrations. Interestingly, studies show that 2.5% benzoyl peroxide is roughly equivalent in effectiveness to 10% benzoyl peroxide. The higher concentration doesn't necessarily mean better results. It primarily means more potential for irritation. Therefore, it's prudent to start with 2.5% and only increase concentration if needed. Benzoyl peroxide comes in multiple product formats. Cleansers containing 2.5 to 5% benzoyl peroxide gently incorporate this ingredient into your daily cleansing routine. These are appropriate for maintenance or mild acne. Spot treatments allow you to apply high concentrations directly to individual pimples. Serums or leave-on treatments apply benzoyl peroxide across your entire face and are left on the skin. These can be used daily or as directed. Gels and creams are thicker formulations that may have different absorption characteristics depending on your skin type. Starting with benzoyl peroxide requires similar caution as salicylic acid. If you're new to benzoyl peroxide, begin with a 2.5% product, ideally in a cleanser format or spot treatment, used once daily. Most people find evening application easier than morning application since benzoyl peroxide doesn't require sun protection and can be easily washed off in the morning. After 1 to 2 weeks, assess your skin's tolerance. If you're experiencing mild irritation or dryness but your acne is improving, continue. After 2 to 3 weeks, if your skin tolerates the product well, you can increase frequency to twice daily or increase the concentration to 5%. Application technique is critical. Apply benzoyl peroxide to completely clean, completely dry skin. This is more important with benzoyl peroxide than with most other products. If your skin is even slightly damp, benzoyl peroxide will irritate more readily. Allow your cleanser to fully absorb and dry, then apply benzoyl peroxide. Use a small amount, about the size of a pea for your entire face if using a leave-on product, or a slightly larger amount for spot treatment. Apply gently, allowing the product to absorb fully before applying other products. Benzoyl peroxide has a particular drawback: it bleaches fabrics and hair. If you apply it to your face, it can bleach your pillowcase, bedding, towels, and hair. Many people apply benzoyl peroxide in the evening and wash it off in the morning with their cleanser to avoid this issue. If you apply it in the morning, be extremely careful not to get it on your hair, eyebrows, or any colored clothing. Some people apply it as a spot treatment right before bed, allowing it to work overnight before being washed off in the morning. If bleaching is a concern, you might prefer using benzoyl peroxide in a wash-off cleanser format where the contact time is brief. Side effects of benzoyl peroxide are generally more significant than salicylic acid. Dryness is very common, particularly with higher concentrations or frequent applications. Combat this by using an excellent moisturizer after applying benzoyl peroxide. Some people find that benzoyl peroxide dries their skin excessively even at 2.5% concentration. If this is you, try reducing frequency to every other day or using it only as a spot treatment. Irritation and redness are common, particularly when starting benzoyl peroxide or when increasing concentration. This irritation is usually temporary and subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, dermatitis, or reactions, discontinue use and consult a dermatologist. Contact dermatitis to benzoyl peroxide, while rare, does occur. If you develop an itchy rash that doesn't improve with reduced frequency, you may be allergic. Discontinue use and inform your dermatologist. Many people experience acne purging when starting benzoyl peroxide, temporary worsening of acne as bacteria die off and impurities are brought to the surface. This purging typically lasts 1 to 2 weeks. If purging lasts longer, consult your dermatologist. Photosensitivity is not a significant issue with benzoyl peroxide like it is with some other acne treatments, but you should still use sunscreen daily for general skin protection. Benzoyl peroxide is particularly effective for inflammatory papules and pustules, the classic red pimples with white centers. It's less effective for comedonal acne, blackheads and whiteheads, where salicylic acid is superior. Many dermatologists recommend combining benzoyl peroxide with salicylic acid for comprehensive acne treatment. Use salicylic acid to address comedones and exfoliate, and benzoyl peroxide to kill bacteria and reduce inflammation. Results from benzoyl peroxide appear relatively quickly, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50, Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41, Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42, Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43, Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44, Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology in Acne Treatment, Nanoparticle Delivery Systems for Enhanced Product Penetration, Liposomal Formulations, Future Nanodelivery Approaches. Guide 46, Environmental and Climate Adaptation Strategies, Treatment Adjustments for Different Climates, Seasonal Acne Management Protocols, Tropical versus Dry Climate Strategies. Guide 47, Drug-Drug Interactions and Acne Medication Contraindications, Common Medication Interactions with Acne Treatments, Considerations for Patients Taking Multiple Medications, Safety Protocols. Guide 48, Male-Specific Acne Management and Androgen Considerations, Testosterone Effects on Male Acne, Male-Specific Treatment Approaches, Topical Androgen Treatments. Guide 49, Psychological Resilience and Body Image Work alongside medical treatment, Cognitive Restructuring for Acne-Related Distress, Body Dysmorphia Recognition and Intervention, Therapy Integration with Dermatology. Guide 50, Acne Resolution Success Stories and Lessons Learned, Compilation of Effective Treatment Approaches, Common Successful Patterns, Motivational Insights, Realistic Timelines for Clear Skin Achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47, Drug-Drug Interactions and Safety Considerations with Acne Medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium risk. Retinoids interact with vitamin A and other retinoids. Never combine different retinoid forms. Additionally, retinoids interact with certain other medications requiring coordination. Guide 48, Male-Specific Acne Management and Androgen-Driven Considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining generally higher acne prevalence in males. Reducing testosterone through lifestyle or medications is often unnecessary and undesirable in males. Male acne is often more severe and persistent than female acne, particularly on the back and chest. This distribution reflects androgen receptor sensitivity in these areas. Hormonal interventions appropriate for females, oral contraceptives, spironolactone, are generally inappropriate for males. Males rely primarily on topical treatments and oral antibiotics. Isotretinoin is considered earlier for severe male acne since hormonal treatments aren't options. Lifestyle factors, stress management, sleep, diet, are particularly important for males since pharmaceutical hormonal interventions aren't available. Guide 49, Psychological Resilience and Mental Health Integration with Dermatology. Integrating psychological support with medical dermatology treatment often produces superior outcomes, particularly for acne with significant psychological impact. Cognitive behavioral therapy, CBT, for appearance. Community health workers trained in acne management can provide guidance and treatment in areas lacking specialist dermatology. Telemedicine potentially extends access to professional dermatology even in resource-limited areas, though internet access is necessary. Simple, low-cost interventions, sun protection, hygiene, lifestyle optimization, remain effective even without expensive treatments. Guide 85, Acne and Gender, Sex-Specific Differences and Considerations. While acne affects all genders, sex-specific hormonal and social factors create gender differences in acne experience warranting gender-specific understanding. Female acne often involves hormonal cyclicity, often concentrating around menstrual cycle phases. Males lack this cyclicity, experiencing more constant acne patterns. Hormonal treatments, oral contraceptives, spironolactone, are standard for female acne but generally inappropriate for males. Males rely on topical treatments and antibiotics primarily. Female-specific acne considerations include menstrual cycle tracking, potential birth control side effects, and pregnancy precautions with acne medications. Male acne might be more severe on average due to higher baseline androgens. However, severe acne affects all genders. Facial hair in males makes treating acne challenging. Beard covers facial acne and prevents topical treatment application. Facial hair also traps moisture and bacteria. Some males benefit from beard care modifications or shaving strategy adjustments. Societal appearance pressure affects genders differently. While appearance standards affect all genders, women might face intensified appearance-focused judgment. Recognizing gender differences allows appropriate, gender-sensitive treatment approaches. Guide 86, Acne Scarring Prevention During Active Treatment. While scarring is addressed post-acne, prevention during active acne treatment is more effective than treating scars after they form. Preventing deep inflammation, which causes scarring, is paramount. Aggressive acne treatment preventing severe lesions prevents scarring more effectively than treating scars afterward. Avoiding picking, squeezing, or extracting acne is crucial for scarring prevention. This is perhaps the single most important scarring prevention strategy. Treating acne early prevents it from reaching severity levels causing scarring. Early intervention prevents worse scarring than treating established severe acne. Professional acne management, particularly using isotretinoin for severe acne, prevents deep inflammation that causes scarring. Waiting years trying home treatments before seeking professional help allows scarring to occur that could have been prevented. Post-inflammatory hyperpigmentation prevention through sun protection prevents darkening of healing acne that makes scars more visible. Barrier health maintenance during treatment prevents excessive irritation that might promote deeper inflammation and scarring risk. Understanding that scarring prevention is more effective than scar treatment motivates appropriate early intervention for severe acne. Guide 87, Acne and Beauty Standards, Challenging Appearance-Focused Culture. Acne exists within broader cultural beauty standard contexts. Understanding and challenging appearance-focused culture helps reduce acne-related distress. Beauty standards have varied historically and culturally, showing that current standards are culturally constructed, not universal truths. Overemphasis on flawless appearance in media and advertising creates unrealistic expectations. Recognizing that almost everyone has occasional skin imperfections helps maintain perspective. Influencer and celebrity appearance standards are curated through makeup, filtering, professional photography, and often procedures. Comparing yourself to these unrealistic standards damages self-esteem. Diverse beauty standards across cultures show multiple ways to be beautiful. Recognizing beauty beyond clear skin reduces acne's psychological impact. Challenging personal internalized beauty standards, recognizing you can be valuable and attractive with acne, reduces acne-related distress. Supporting others in valuing themselves beyond appearance helps shift culture away from appearance obsession. Advocating for more realistic, inclusive beauty standards in media reduces social pressure perpetuating appearance anxiety. Guide 88, Acne Treatment Adherence and Habit Formation Science. Understanding adherence and habit formation improves your ability to maintain treatment consistency long-term. Habits typically form through repetition. Repeating skincare routines consistently for 2 to 3 months makes them increasingly automatic, reducing conscious effort required. Environmental design supporting habits increases consistency. Placing skincare products visibly, creating dedicated skincare spaces, and removing friction, having products easily accessible, supports adherence. Cue-based habit formation, attaching skincare to existing habits like brushing teeth, increases consistency compared to time-based cues. Remember to do skincare. Reward associations with skincare, pleasant-smelling products, enjoyable ritual, positive reinforcement, increase adherence through positive conditioning. Accountability partnerships where you report to someone, friend, family, online community, increase consistency through social commitment. Motivation fluctuates. Understanding that motivation naturally varies and developing systems that work regardless of motivation, habit, routine, environment design, helps maintain adherence despite motivation fluctuation. Self-compassion toward occasional lapses prevents them from derailing entire routines. Missing a day occasionally doesn't mean failure. Restarting immediately prevents occasional lapse from becoming permanent abandonment. Guide 89, Acne and Sensory Sensitivities, Managing Treatment for Sensitive Individuals. Individuals with sensory processing sensitivities, common in autism, ADHD, and sensory processing disorders, might struggle with standard skincare routines. Adaptations help these individuals maintain treatment compliance. Sensory preferences vary individually. Some find strong scents overwhelming, others find unscented products leaving no sensory feedback. Understanding your sensory preferences guides product selection. Texture sensitivities affect product tolerability. Lightweight serums might feel pleasant while thick creams feel cloying. Smooth absorbing products feel better than sticky formulations. Temperature sensitivities might affect water temperature for cleansing. Some prefer cool water, others slightly warm, never hot, which damages skin. Routine predictability helps sensory-sensitive individuals. For example, establish stable benzoyl peroxide use for 4 weeks before adding salicylic acid to your routine. Use complementary treatments on different parts of your routine when possible. For example, use salicylic acid cleanser in the morning, brief contact, mild treatment, and benzoyl peroxide leave-on at night, extended contact, potentially more irritating. This separation minimizes cumulative irritation. Monitor for excessive irritation. If combining treatments causes significant redness, dryness, peeling, or sensitivity beyond what either treatment alone causes, reduce frequency of one or both treatments. You can use both treatments but at lower frequencies, for example, benzoyl peroxide once daily instead of twice daily, or salicylic acid 2 to 3 times weekly instead of daily. The sandwich method reduces irritation when combining treatments. Apply your first treatment, perhaps benzoyl peroxide, wait 20 minutes, apply moisturizer, then apply your second treatment, perhaps retinoid. This dilutes treatment somewhat and reduces irritation while maintaining efficacy. Some combinations should be avoided or approached cautiously. Vitamin C and benzoyl peroxide together can reduce vitamin C effectiveness, so apply these at different times. Retinoids and strong chemical exfoliants used on the same evening can cause excessive irritation. Separate these if combining. Benzoyl peroxide with niacinamide is generally fine, though separating them, benzoyl peroxide at night, niacinamide in morning moisturizer, is easier. Assessment of combination therapy effectiveness requires patience. Most people need 8 to 12 weeks of consistent combination therapy to determine if it's working well. Acne doesn't improve overnight. Allow adequate time for evaluation. Adjusting combinations based on response is important. If one component seems essential while another isn't providing obvious benefit, you might discontinue the less beneficial component. Conversely, if you're experiencing insufficient improvement, you might increase one component's frequency or concentration, or add an additional treatment, perhaps adding retinoid to an existing benzoyl peroxide and salicylic acid combination. Professional guidance is valuable when considering combination therapy for severe acne. Your dermatologist can recommend appropriate combinations, warn about potential interactions, and guide introduction sequencing. Don't hesitate to discuss combination therapy approaches with your dermatologist. Guide 24, Understanding and Managing Fungal Acne, Malassezia folliculitis. Fungal acne, more accurately called Malassezia folliculitis or Pityrosporum folliculitis, is often misdiagnosed as bacterial acne. This condition presents similarly to acne but results from yeast overgrowth rather than bacterial infection, requiring different treatment approaches. Understanding this condition prevents prolonged ineffective treatment with standard acne medications. Malassezia is a naturally occurring yeast on human skin. In most people, it colonizes skin without causing problems. However, in some individuals, conditions favor Malassezia overgrowth, leading to follicle inflammation and fungal acne appearance. Unlike bacterial acne caused by Cutibacterium acnes, fungal acne results from yeast proliferation. Fungal acne typically appears as uniform, small pustules, often in clusters on the back, chest, and shoulders, though facial fungal acne occurs. The pustules are often quite uniform in size and appearance, less variable than typical bacterial acne. Fungal acne is often very itchy or uncomfortable, more so than typical acne. It often appears or worsens after antibiotic courses, as antibiotic elimination of competing bacteria allows Malassezia to proliferate unopposed. Several factors promote Malassezia overgrowth. Warm, humid environments favor yeast growth, explaining why fungal acne often worsens in summer or in humid climates. Excessive sweating creates favorable conditions. Wearing tight, non-breathable clothing traps moisture and heat, promoting yeast overgrowth. Immunosuppression or diabetes can promote yeast overgrowth. Recent antibiotic courses allow Malassezia to proliferate. Oil-based products and heavy moisturizers can promote yeast growth in susceptible individuals. Diagnosing fungal acne requires suspicion. If your acne doesn't respond to standard acne treatments, doesn't respond to antibiotics, or started after antibiotics, fungal acne is possible. Your dermatologist can perform a KOH, potassium hydroxide, preparation or fungal culture to confirm malassezia, though clinical diagnosis is often sufficient. Standard bacterial acne treatments are ineffective for fungal acne because they don't address yeast. Benzoyl peroxide and salicylic acid have minimal effect on malassezia. Antibiotics don't treat yeast. Retinoids don't specifically treat yeast. Using these treatments on fungal acne can be frustrating. You follow a good acne regimen but see no improvement because the underlying cause isn't bacterial. Topical antifungals effectively treat fungal acne. Ketoconazole, available in shampoos and creams, kills malassezia. Apply 2% ketoconazole cream to affected areas daily. Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Includes hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, antiandrogen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans-feminine individuals. Timeline for hormone therapy. Acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12, Treating Post-Inflammatory Hyperpigmentation and Acne Scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, niacinamide shows improvements in PIH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azalex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to 8 weeks. Kojic acid inhibits melanin production. Available in serums and creams at 1 to 2% concentration, applied daily, kojic acid gradually lightens hyperpigmentation. Results take 4 to 8 weeks of consistent use. Kojic acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called achronosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are three main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist, though complete elimination is often impossible. The goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple Manage this by stopping all actives temporarily and using only gentle cleanser, hydrating moisturizer, and sunscreen for 1 to 2 weeks. Allow your skin barrier to repair. Then gradually reintroduce treatments at lower concentrations and frequencies. Building tolerance to treatments requires patience and gradual progression. Start conservatively and increase gradually. This approach takes longer initially but leads to better long-term outcomes than aggressive starting that causes severe side effects and treatment discontinuation. Remember that slow, consistent progress is preferable to fast progress interrupted by side effects forcing you to quit. Guide 19: The Complete Long-Term Acne Maintenance and Prevention Plan. Once you've achieved clear skin, the challenge becomes maintaining clarity. Many people achieve clear skin only to abandon their routines, resulting in acne recurrence. Understanding long-term maintenance prevents this cycle and keeps your skin clear indefinitely. Continue your core routine indefinitely. The Cleanse, Treat, Moisturize, Protect routine that cleared your acne remains essential for maintaining clear skin. Don't abandon these steps thinking they're only necessary while acne is active. Your skin's tendencies haven't changed. Stopping treatment allows acne to return. Identify which specific treatments worked for you and continue them. If salicylic acid was crucial to your success, continue using it at maintenance levels, perhaps 2 to 3 times weekly instead of daily. If retinoids were essential, continue them nightly or at whatever frequency you use successfully. If benzoyl peroxide was key, continue it. Maintenance doesn't require the aggressive frequency you may have used during active acne treatment, but it requires continuing the treatments that worked. Simplify your routine for maintenance if desired. During active acne treatment, you might use multiple actives, but once clear, you can often maintain clarity with fewer products. For example, you might maintain clear skin using just retinoid at night and benzoyl peroxide spot treatments as needed, dropping the salicylic acid cleanser you used initially. Experiment to find the minimum effective routine for your skin. Monitor your skin monthly for early signs of breakout. Catching pimples at the very first sign and treating them aggressively prevents them from developing fully. Many people can prevent significant breakouts through early intervention with spot treatments when they notice the first small bumps. Keep your skincare routine on hand. Never run out of your essential treatments. Having spare bottles ensures you never skip treatments due to product unavailability. Some people order backup products when their current product is half empty, ensuring continuity. Identify your acne triggers through your skincare journal. Did acne worsen during stressful periods? After consuming certain foods? During certain times of your menstrual cycle? After skipping your routine? After trying new products? Understanding your personal triggers allows you to implement preventative strategies. If you identify stress as a trigger, prioritize stress management. If certain foods worsen acne, avoid them. If hormonal cycling causes breakouts, prepare in advance with more aggressive treatment during high-risk times. Seasonal adjustments may be necessary. Some people experience worse acne in summer, increased heat, humidity, sun exposure, or winter, dry air, heating systems. Adjust your routine seasonally, perhaps more frequent use of oil control treatments in summer, more aggressive moisturizing in winter. This flexibility maintains clear skin year-round. Maintain the lifestyle habits that support clear skin. Continue stress management, adequate sleep, regular exercise, healthy diet, and hydration. Don't revert to poor habits thinking your clear skin is permanent and won't be affected. Lifestyle factors remain important indefinitely. Schedule regular dermatology visits even after achieving clear skin. Annual checkups allow your dermatologist to assess your maintenance routine, adjust treatment if necessary, and catch any skin concerns early. Regular professional oversight prevents complications and ensures your long-term skin health. Handle occasional breakouts strategically. Everyone experiences occasional breakouts despite perfect routines, a particularly stressful period, new product irritation, or unknown trigger can cause isolated pimples. Treat these immediately with appropriate spot treatments. Don't allow occasional breakouts to discourage you into abandoning your routine. If you notice increasing breakouts despite consistent routine, assess what has changed. New products? Increased stress? Dietary changes? Hormonal changes? Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves, new evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. Contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances, severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. start conservatively with treatments. Begin with a single or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible or combining lithium with aggressive acne treatment might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking. Oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible, though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92. Acne prevention in high-risk children and adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93. Acne in performing arts and image-dependent professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94. Acne and sleep disorders, managing acne while managing sleep issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95. Acne and fertility, female and male considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretical treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths, some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles: never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen